Hi again. Uh, Good afternoon on this beautiful fall day. I don't even know what day it is. I think it's September 27th, actually. It's so pretty outside, blue skies. I want to quickly talk to you about what kind of doctor that you need to seek out if you are testing positive for Lyme disease. So many of us go undiagnosed and misdiagnosed for so long that this disease has way too much time to spread and take over our bodies because generally speaking, our primary care physicians might not know a whole lot about it. So I want to talk to you about an LLMD and an ILADS doctor. So all an LLMD is really it's a Lyme literate medical doctor, and it can be like a nurse practitioner or a PA or something like that. It doesn't necessarily have to be a doctor, but they believe that Lyme disease exists and they educate themselves on it, and they try to, within certain boundaries, help treat their patients. These guys have and girls have to go by CDC guidelines, unfortunately, and in doing so, they're limited as to their scope of practice on how they treat us. An ILADS doctor is somebody that has had, I think, a little more training and really dedicates their time. And that's my dog growling. Kate, stop it. Stupid dog. An ILADS doctor, they've studied a little more with some of the best. Like I know my ILADS doc studied with Dr. Rawls. She's met Stephen Buhner, just names that as you go through your journey, you're going to start to recognize. And so you need to seek out a doctor that can really help you and work with you and not disregard you or make you think you're crazy. My PCP didn't do that to me. He's willing to help any way that he can. He just isn't considered a Lyme literate doctor. He doesn't know how to treat the disease, but God bless him because he's been a wonderful support, him and his team. So you need to find out in your area who is able to treat you. And so it's not unusual for us to go years being misdiagnosed. And I'm going to read some of these diagnoses. It's very disturbing. I have them on my iPad, and there's too many of them. I gotta read from my iPad. So a lot of people that have Lyme disease are being misdiagnosed with these diseases. It's a long list. Chronic fatigue syndrome, colitis, Crohn's disease, early ALS, early Alzheimer's, encephalitis, fibromyalgia, fifth disease. I have never even heard of that. Acid reflux, infectious arthritis, interstitial cystitis. I used to get chronic UTIs. Goes all the way 4 years ago. And I just found out this past week that I didn't have interstitial cystitis, and all these chronic UTIs were as a result of this stupid Lyme disease. So keep that in mind. Irritable bowel, juvenile arthritis, lupus is a big one. MS is another big one. Osteoarthritis, psoriatic arthritis, all kinds of psychiatric disorders, which pisses me off. People are just going to tell you you're crazy and what you have isn't real. You're attention seeking, you're bipolar, you're all these things. And you may have underlying mental illness and take medications for it. Like chronic depression runs in my family. I was on psych meds for a long time. Strangely enough, I'm off of them now, which that's a whole different story. But don't let people say you're crazy. There's more to it, idiots. Raynaud's, rheumatoid arthritis is a huge one. scleroderma, sojourns, all kinds of sleep disorders, thyroid disorders. I'm waiting to hear back from a friend. He has been misdiagnosed, we think, with rheumatoid arthritis. So what ends up happening is then you go through all these months of or years of misdiagnosis, and then this disease is just eating you alive. So, there might be a time where you, in the course of your treatment of Lyme's, have to get a cardiologist, or you might need to get a rheumatologist because of what it has done to your body, but it is a symptom of and a side effect of Lyme disease. It wasn't the initial problem, if that makes sense. So another thing I would suggest is there is on Facebook a group called Lyme Warriors. I go on there all the time when I have questions, and this girl Lauren that runs the group, she just always has a ton of information, so I would suggest going there too. So if you're having all these crazy things that these doctors can't seem to really pinpoint a diagnosis, do your research on Lyme and its co-infections and see if maybe one of those makes more sense and kind of fits the bill for you, okay? Good luck out there. Sending you love and light, and everybody enjoy the weekend.